Hi, everyone, and thanks for joining us today. I'm Kelsey Duggan, Quantic's Associate Director of Brand Marketing, and welcome to this special edition of Quantic Conversations. We're thrilled to introduce today's guest, Dr. Dan Durand, Quantic Executive MBA graduate and Chief Medical Officer and President of Prenuvo Medical Group, the world's largest network of clinics dedicated to proactive whole body MRI scans for early disease detection and precision medicine. Prenuvo has been making major headlines lately. You all have probably seen a few, not only for its groundbreaking AI powered diagnostic technology, but also for its impressive momentum. The company has raised more than $100 million in funding and has been featured in major outlets like Forbes, TechCrunch, and Fast Company. It's definitely safe to say they're helping redefine the future of preventative healthcare. In today's conversation, we'll explore Dr. Dan's extraordinary career journey from leading innovative healthcare organizations to helping launch and scale Prenuvo's global impact. We'll also dive into how AI powered diagnostics are transforming healthcare delivery and revolutionizing early disease detection worldwide. And we also know many of you in the quantum community are deeply passionate about healthcare innovation, emerging technologies, and entrepreneurship. We promise that today's session is packed with valuable insights into how data driven leadership and AI can help shape the next generation of healthcare solutions. But before I officially bring Dr. Dan onto the screen, just a few quick housekeeping notes that we always like to give. Today's session will run about 30 to 40 minutes long. It will be recorded for on-demand viewing, so if you have to leave us, don't worry, know that you can always come back here and watch the conversation in full length. And if you're joining us all live, welcome. It's lovely to see people already writing in the comments. We'd love to hear from you, so please feel free to leave a message there. Let us know where you're tuning in from. Please feel free to leave any questions that you might have throughout the conversation for Dan. If we do have time at the end, we always like to answer a few of those if there's time, like I said. So thank you again for tuning in. And I think with that being said, we're ready to get started. And I'm so excited to officially welcome Dr. Dan Durand to the screen. Hi, Dan. Thank you for joining us.
Thank you, Kelsey. It's it's a pleasure to be here.
No, thank you. We're so excited for this conversation. Very excited for all of your insights into kind of all things AI, healthcare, your career journey. I guess just to kind of kick things off, I know that this conversation is going to be packed with a lot of great insights, but we mentioned it a little bit in the introduction. But for those of us who might not necessarily be extremely familiar with the concept, what exactly is Prenuvo and how does it differ from a traditional medical checkup or a typical MRI scan that we all might be familiar with and used to?
Yeah, so Prenuvo is, as you stated, it's the world's largest network of clinics that are exclusively dedicated to whole body MRI. And recently, we've also added a panel of labs for those that want that kind of information as well. But our core capability and what we've been focusing on the first 8 years as a company and for another decade before that as a clinic is someone comes into a Prenuvo and all they need to do once we've established that they're appropriate for the exam and safe for the exam, in other words, they don't have any metal or things in their body that might make MRI dangerous. But once we know that they're safe and that the exam's appropriate for them, they lie down inside an MRI machine. Initially, it was for an hour. And in the last few years, because of AI technology that we've adopted from our partners, it takes about 40 to 45 minutes. They lie down in that machine and it takes information out of them. It doesn't expose them to anything like radiation or pain. All they do is lie in this machine, and through magnetic waves and electromagnetic information, the MRI machine extracts the information for them. Okay, they don't give anything. Like when you give blood, you give a little bit of blood. If you take enough blood samples, you could wind up anemic, right? So the wonderful thing about this technology is we take nothing, we disturb nothing from the body, and in that way, it's similar to most of what we call non-contrast MRI, meaning MRI where we don't have to inject anything into the body. But we do it for the whole body, and that's the difference, head to toe for most of our exams. And it involves making a lot of trade-offs, because if we had an unlimited amount of time, we could get really exquisite images, let's say, of the brain, right, of just that organ. When you do 45 minutes for the whole body, you have to make trade-offs and decisions on exactly what kind of information you want. But the great thing about AI, which we'll talk about later on, is that when you add AI to MRI, you're able to get more and more information per minute that you spend on the scanner. So those trade-offs that I discussed before, they're less and less important every year. We can just pull more information through. And so Prenuvo is the idea that by doing this with MRI and eventually with other modalities, that if you gathered as much data as you can about the patient in a way that doesn't hurt them, that isn't uncomfortable, that you can help them detect things that may be wrong with themselves, understand their current state of health versus just waiting for diseases to happen, right? And then take multiple measurements on a time course and show that patient as they age and as they optimize their health, those two different things that will be going on for a compliant and adherent patient at the same time. So I'm just going to repeat those three things because they're going to be relevant to the rest of the conversation. The first thing we can do with this is we can detect diseases. A lot of them, not necessarily every disease at all stages, but very, very powerful for disease detection and not always diagnosis, often just detecting, which then they see other doctors and they receive an actual diagnosis. But sometimes we're able to diagnose a disease like an aneurysm or let's say fatty liver disease or other things where you only need non-contrast MRI. So disease detection, right? The second thing is understanding the current state of health, things like body composition, the volumes of the various different organs and how that relates to the age and sex max controls of where that person should be compared to. And the last thing is this idea about multiple endpoints and getting this periodically to optimize these biomarkers and optimize one's health. And overall, the idea is proactive healthcare, understand your data, understand your biology, optimize your health. Don't wait for disease and aging to happen to you.
That's amazing. Thank you for that well-rounded answer. And it really is incredible that this is such a non-invasive thing that people can do, but also, I mean, early detection for so many diseases is critical. And so please correct me if I'm wrong, but I'd love to have, it was a perfect segue to get in kind of the AI powered, a concept for this whole body MRI scan. And please correct me if I'm wrong, but I believe you can detect over 500 different medical conditions. Here at Quantic, as you know, we love learning about all things AI. Can you elaborate a little bit more on that specifically? How is AI used in this to enhance the accuracy and the efficiency of these scans?
So today we use it mainly to enhance the efficiency of the scans.
Mhm.
When you go in an MRI machine, the machine detects different changes in radio waves and basically electromagnetic radiation that is put into the patient and comes out of the patient. And then it uses a computer to reconstruct the image. So the images that we see with things like MRI and CT, they aren't real images. They are reconstructed images. And they're reconstructed based on the data that comes back. That data that comes back is referred to as case-based data. And there's two ways to use AI essentially to be more efficient. You can either have it sample only where it needs to in case-based to reconstruct the image, or you can take the image that it forms and you can sort of smooth that out and make it look pretty. And our philosophy with Prenuvo is we like the earlier one because that's where you're optimizing for the actual information content. If you just smooth out the image, it may make it look pretty, but it doesn't necessarily mean that is a higher diagnostic quality. And as I referenced before, MRI technology is basically you put someone in a magnet and you put energy in and you get energy back. And that principle hasn't honestly changed terribly much since the 1990s. What has changed is how you're able to get the signal out of the noise, figure out the information that comes back, what's real and relevant versus what isn't. And AI is fantastic at doing this. There was historically mathematical formulas that are general formulas and general approaches that were actually hundreds of years old that were applied to electronics, things like called a Fourier transform. And these things do pretty well. But machine learning based algorithms are much, much more efficient at figuring out for a given sample how exactly to get the signal out of the noise and how to separate them. And you can think of AI as kind of like in a way, AI is like a vacuum sucking the information out of this MRI machine. And every year, the vacuum gets stronger, and we're able to suck out more information per unit time. And that right now, for both Prenuvo and I think most of medicine, is where AI is really doing its heaviest lifting, because it's like almost on every case, we're getting better information. For those that use CT, which we don't, it means lower radiation doses, right? They can put less radiation in. So this is going on everywhere, and the big device makers are the ones that are developing these things, and we're generally licensing it from them. The next thing you could do with AI, though, is, okay, now you've acquired all this data, and every year and a half, the amount of healthcare data throughout the world like doubles. And it's because there are more folks like Prenuvo acquiring more data. There are Samsungs like your Apple Watch, there are wearables like Samsung or your Apple Watch or WeThings, all these things that we get that can enrich our lives. They create a lot more data too. And all that needs to be stored. And for it to be meaningful to somebody's health, broadly speaking, there are three things that can happen. The person can interact with it themselves, right? But consumers have like a limited understanding, right? Like we don't understand as consumers everything if we're not experts, but also like we have limited time, like everybody does. The second thing that can happen is you could have an AI algorithm pour through all this data and deliver the consumer insights directly. And the third thing that can happen is a physician, with or without AI, can sort of look through data, or other healthcare provider and deliver that to the patient. So obviously, Prenuvo, we're like that third one, and there are some instances where we're taking AI that we've developed in-house that's FDA cleared, and it basically looks at a person's body. It outlines all the muscles and all the fat in the body, and then it gives us back a really precise measurement of how much body fat they have versus muscle, and not just body fat, period, but the different types of fat, because things like visceral fat are known to lead long-term to problems like neuroinflammation and neurodegeneration. And things like subcutaneous fat, while you want to have maybe less of it, it's less harmful than things like visceral fat or epicardial fat. So it's like this next level of intelligence. In the past, if you were working with a patient and you're trying to get them to optimize their health, you might be talking to them about something as simple as just like, let's say BMI, right? Like, which is basically how tall you are divided by, or how much you weigh divided by how tall you are in the metric system. It's a pretty blunt instrument, because you can imagine there's some really fit people that just have more muscle, right? And so what are you going to tell them? Their BMI is high. Like, I guess technically they're overweight, but is that something they want to change? Because we actually know that muscle mass is highly predictive of longevity, right? It's a good thing, generally speaking. You can have too much of it, but that, you can also be in a good situation and still be overweight on your BMI. Likewise, you could talk about percent body fat, but if someone is almost all subcutaneous fat and they're right at the threshold of percent body fat, that's probably not a big deal, right? But if they have all visceral fat, then that could be a big deal, well below the usual thresholds for recommended body fat. So the more precise we get with what we can measure, the more valuable the information and the more precise we can deliver care to that patient. This is what we talk about precision medicine. And that's where I think you'll see the biggest development of new AI. And that's, we have one product that we've developed in-house, and we have a few products that we've sourced from others. And this is like, so there's the AI, the first bunch of AI is acquiring the data more efficiently, and that's mostly from device makers. And then the second thing is how you allow physicians to get insights that would have taken them, 15 hours. Like if I was to sit down with a patient's scan and measure out all the fat and then quantify how many how many milliliters it was, like that would take me 24 hours probably. But the computer can do it in 50 milliseconds, right? And then just tell it to me. And then our preventative care folks can discuss it with the patient. And then obviously there's a lot of algorithms out there that detect lesions, right? And that's another class of AI that we've developed from a research perspective internally. And we hope to bring some of that forward over time for formal products as well.
That's fascinating and honestly so valuable, like you said, for patient care. Kind of segueing a little bit, still revolving around patient care, but I'd love for our audience to learn more about your career path and journey, Dan. So what inspired you to kind of transition from a more traditional healthcare role, some of these that you previously just mentioned that answer, to Prenuvo? What inspired you for that? We have a few people in our audience that I'm sure are also going through, transitioning for their career journey. So would love advice and just kind of background on there as well.
Yeah. Well, I think I'm like anybody else. I've looked for something in my life that I find meaningful and that I also enjoy, right? And those things can change over time, right? I mean, the things that you find meaningful in your mid-20s may be different, and the things you enjoy in your mid-20s or mid-30s. So I'll give a brief account of my career, but some of it was due to changing preferences. And then Prenuvo is just a really nice serendipitous combination of a lot of things that I found meaningful before. And then, it was a very unique thing that I felt that I could uniquely contribute to. So I started out conventionally. I went through medical school, and I went to an internship, a residency, and a fellowship. So this, if you had told me at the beginning of med school that it would take 10 years to become like a real practicing doctor, I don't know if I would have done it. I didn't have any family members that did it. I mean, they tell you that, but you don't really like put it together in your head. You're just very focused on like, I got 4 years of this and then some training, but I'll be a doctor. But, it's just a long period of time. And I got to the end of that, and I was an instructor level faculty at Hopkins during that last year, that fellowship year. And I did a combined fellowship with some money from the RSNA that was actually looking at molecular imaging, and it looked at radiation requiring methods like PET, and it looked at MRI. And so I spent a year thinking about that. And as I was focusing that year, I also, learned and kind of experienced that I didn't like academic medicine as a full-time calling. I spent a lot of time training, and I wanted to kind of get out there in the world. And so pretty quickly in my career, I went and I got a job full-time with McKinsey and was practicing radiology part-time. And I did that to just sort of get out there. I was in their DC office, so it allowed me to work both in public, private, and the nonprofit space, or the government space. So I sort of worked for nonprofit health systems. I worked for-profit health systems, and I did engagements with the federal government on healthcare policy. This is the beginning of the ACA, the healthcare reform, back in 2012. Mm-hmm. And I found that I really liked this thing called value-based care that was basically about how do we get to better health outcomes. Instead of just paying for stuff that we do to people when they get sick, how do we start re-engineering the system? And a lot of that actually, I didn't know at the time, but where that evolved was a lot of the concept of quality was both better outcomes, but also to deliver better preventative care. So as I focused on that over the next decade of my career, which I'll talk about in a second, I ended up learning a lot about preventative care. So I'm sort of this person with a very deep science background, trained at Hopkins exclusively for medicine and radiology. And then I got really deep in preventative care through the stuff I actually did as an adult learner, right? And health systems design. And so that consisted of, after McKinsey, I went and I helped start up a company called Evolent. It was based on value-based care. And that went public a few years later. Once it went public, or right around when it went public, like almost simultaneously, I exited and went to Hopkins and ran their value-based care operations for their ACO. And then pretty quickly, there was a health system that I had partially trained at while at Hopkins called LifeBridge that had a lot of shared residencies, and they offered me a role where I would be over imaging as well as their value-based care. And so I went over to LifeBridge, and I ended up spending about 10 years there. We grew the health system. They were getting their third hospital right when I joined. By the time I left, they had 5 hospitals, I think 125 different locations. And we really grew the value-based care arm out and the radiology group out. So that's this decade immediately preceding Prenuvo. And Prenuvo was this sort of opportunity to build a health system around preventative imaging, right? So it's just one of those things where as soon as I heard about it, I'm like, well, I have to do this, because who else? There are very few other radiologists that have had this other circuitous career. So who's going to be as interested in this as I am? Who's going to be able to bring as much, kind of like just enthusiasm and depth to this? So I literally, I kind of picked it because I enjoy, my boss, and I enjoy the people I met, and I enjoyed the culture. But I really felt like this role must have been designed by the universe for me. So.
Mm-hmm. Oh, absolutely. No, I feel like in that answer, I feel like you've mentioned all of this, and perfectly explained this, but I really do feel like you perfectly kind of combined, medical, business, and your tech expertise in such a powerful way. And I know we have some listeners out there as well. What advice would you have for others looking to build kind of this similar hybrid type career, which I feel like is becoming more and more prevalent each and every day, honestly?
So I think if people ask me this all the time, you could say that I jumped around a lot, but I also stayed at one place for almost a decade in the middle there at LifeBridge. So I think the jumping around is helpful somewhat early in your career. Like I said, I was at Hopkins for my whole education. So it's I was at Hopkins for 11 years, right? And then I jumped around a little bit with some one startup, one big name company. Then I went and Hopkins again, and then I went with LifeBridge for a decade. And now I've been with Prenuvo for about a year and a half. I think the value of the LifeBridge thing was being somewhere long enough to see the upsides and the downsides of your decisions, living with your triumphs and your failures. That's important. But I think moving around a lot at different points in your career is also important to get a larger breadth of experience, so you don't wind up with sort of a provincial or kind of inbred mentality of only having been in one place. And I think it's really important to get out. Consulting jobs are great. I mean, there's all sorts of positives and negatives to consulting jobs. A positive, a real big positive, is you get to massively broaden your network and your perspective and understand what medicine look like, or whatever sector you're in. What does that look like in all 50 states? What does it look like in other countries? And you'll be astonished at how much of the framework that you have about your profession, about how things should look, a lot of that is clearly arbitrary when you go somewhere else and they're doing it somewhere totally different, right? Mm-hmm. So those are the advice I give people is, number one, which I started with, it was do what you love, right? That if you're never going to be able to do much of it if you don't love it. Mm-hmm. It should be something you find meaningful as well. And then as you're kind of getting your footing, I think it is important to not just be one place and get out there and experience things. Earlier in your career, it's a little easier to do that. But I also think it's important to eventually, kind of grow up and take a job for at least 5 years. Because what, in my field anyway, and this may be different in other fields, it's hard to build anything of significance in healthcare in under 3 years. I mean, it just is almost impossible. And so I'm about halfway through building what I'm really here to build, at Prenuvo right now. Like I would, I really, you put a gun to my head today. I have to stay here to get at least to like this first level of the build of what I want to see. And at LifeBridge, that took me at least, I would say, the first 5 years to really build something to where it was functioning the way that I had envisioned when I took the job.
Absolutely. No, and again, perfect segue. I feel like, you mentioned the failures and the triumphs. Speaking of triumphs, I have to congratulate you all, Prenuvo, receiving your recent 120 million Series B funding. That's incredible. As you already know, through the Executive MBA program here at Quantic, we have many entrepreneurs and they're on kind of their own startup journeys. I would love, and I'm sure they would love to hear as well, what advice do you have for those in kind of those growth stages searching for either that Series A or B funding?
Yeah. So that was announced recently and it was done last year. And my role in that as CMO is mainly to talk about like the medical, aspects of what we're doing and how it relates to the rest of medicine and what, why I think it is a good idea and particularly to talk through like the values and quality of what we're doing. So I think it's important with fundraising, like there's a lot of potential audiences for fundraising, and there's a lot, and there's a lot of people that will tell you, hey, here's what people want to hear about right now. And I think it's important that amongst the executives that you really think about what are our values, right? What are we really trying to do for the world? This can sound like pedantic or cheesy, but it is that sort of like mission, vision, values. Like your fundraising shouldn't take you off of that, right? It actually should reinforce it. And I think it definitely did in the case of the process that we went through. It was very reinforcing and very valuable just for like internally, like for us to put all this stuff down that we would have to communicate to others. But you will, and when you make the decisions on where you take your money from, think about the voices you want to be hearing, because those are the voices you're going to be hearing, right? And so if you're trying to really change healthcare, if you start out by taking money from all the usual players in healthcare, then you're probably going to have a hard time really innovating, I would say. I think there's I'm not going to say never take money from a health system or like a blues venture fund. Like there are some great organizations out there that are traditional healthcare players that also lend money, but ultimately they're going to be on your board in the room, and they may not have the innovative DNA in them, right? So like one of the things I love about our board and the work, those who invested in us, is we've really taken a lot from places that are just trying to innovate society in general, and then also places that really understand technology, right? And we definitely have healthcare voices involved, and I'm certainly one of them. But I think that's what pushes us, right? That's what pushes me, is that I'm not talking to the same crowd of people that I've talked to for the first 20 years of my career, that I'm hearing from people that just have a totally different viewpoint on the world and on the way that organizations can change the world.
Absolutely. No, and I think that that's a great combination. I feel like, talking to people with different viewpoints, as you said, kind of, the mission behind patient care, but also combining it with that sweet spot with innovation to continue to build upon this. I'd love to know, bringing it to a broader scale, how do you envision AI, machine learning in shaping kind of the future of healthcare and preventative care, particularly as we've been talking about in this whole conversation with early disease detection? Where do you think it will go, and where would you like to see it go in the future as well?
Yeah, I think about the easiest way to understand how I think that data and I ultimately will change healthcare and are changing healthcare is to sort of like take ourselves out of healthcare and just think of it about a different part of our life, and navigating one's health is it's different from, but has a lot of similarities to navigating to wherever you're trying to go, right? And if you think about going to a place that you didn't know much about or didn't regularly go, back when I was growing up in the 1990s. I mean, this like literally involved, and it's hard for people to understand this, but in the early 90s, before the information superhighway existed, right, which is the first name for the internet, um, you'd literally get like a Rand McNally map out. And if you didn't have one, you'd like go somewhere to get one. And then you'd be sitting there with this piece of paper. And I mean, people talk about distraction with texting and things like that. But I feel like we're forgetting that we used to have maps like in the passenger seat. So you can imagine like a teenager trying to drive somewhere. They got a Rand McNally map opened up that's like folded, that's like, crinkling in different directions, and they're trying to figure out how to get somewhere. Like this wasn't a great situation. And you contrast that with today, which is like through all these different iterations, first you'd have Yahoo Maps, then you'd print the map out, right? That was kind of annoying, but at least you had instant access to it. Then it started appearing on your cell phones, which was, I would say better than maybe the map falling around your passenger seat, but also like you're kind of context switching between the phone, and you're probably not supposed to be doing that, right? Now we have it like built in, integrated into your dashboard in most of these like latest cars, and you can either go with what the map that the car company gives you, or it can be piped in from your Apple CarPlay, right? Like, and you get this navigation, you're getting voice navigation, and we all take it for granted. Like we're like never lost anymore, except when we don't have those things, then we're super lost, right? but we're like never lost anymore, and that's like a big change. It's like such a big fundamental human change from the way human beings lived for all the millennia that occurred before that, and now it's like we're never lost as long as we have these devices. So what is the equivalent for healthcare? Well, if you gather enough data and you have enough layers of analytics and enough ways to deliver this to people, right, then people can navigate their lives better. They can make better decisions every single day on how they're going to optimize their health if they care about it, right? But I think most people do care about it. And I think in particular, modern life is busy, and the modern healthcare system is it's many things, and it's certainly well-meaning, but it is ultra complex and very easy to get lost in. And a lot of people don't enter it. They don't really even enter into preventative care. They don't even enter into health optimization because they are intimidated about wasting money and being lost. And they have a million other things going on in their mind and their life. So that's where I think AI really will play the role, is we will gather lots of information on people. And I want that to be done as, compassionately and painlessly and non-invasively as possible. And then this information needs to be made meaningful to people, to patients. And that can happen with or without doctors. I mean, there's some of it that will have to happen with doctors. But like, I'm not one of these people that thinks because if all of it has to go through the doctors, that's going to really limit, or even the providers, right? That's going to limit what patients can get. So one of the biggest things we have right now is like regulatory bottleneck. Like it's not, I wouldn't say it's regulatory capture, because it's actually kind of a lack of regulations. And there's the governance going on, the multifaceted governance going on within the field of medicine about, here are the problems we've always had about pathology and how patients die and things we're trying to combat. Here are the problems we have about lifestyle, right? Here are the potential solutions we have in all these technologies. But in medicine, the construct is that there's a highly regulated industry because we don't want to do harm, right? And that's where I think the bottleneck is today is almost all the AI I've discussed is older vintage AI. It's machine learning type AI. It's stuff that was developed between 2012 and 2020 before LLMs, the kind of famous ChatGPT dawn of LLMs. There's, on the care navigation side and the chatbot side and the revenue cycle side, which is revenue cycle is not a part of healthcare I get particularly excited about, but it is, a necessary thing. But on these back office type things or the non-clinical patient interactions, there are some LLM things going on. Like, we're not really using these things yet, but there are those who are, right? But in the really meaningful part of medicine, it's pretty unclear how LLMs are going to get into it. And I think that the FDA, this is something they're clearly going to move on, in the next couple of years, or hopefully a couple of months, because until we have a good regulatory framework, it's going to be hard for the latest and greatest AI to benefit patients and help them sort of navigate their health with all this. And if you don't give them AI, it becomes really crippling, right? Because we've gathered all this data and healthcare is expensive, right? And we have all these providers, but there's a provider shortage, right? So without that AI, I worry that the data will kind of choke the healthcare system and make it worse rather than better.
No, absolutely. No, that's extremely interesting to think about. Also, I love that map analogy. And yeah, I'm so sorry to my parents for every road trip where we did have those old school maps and I was in charge. But it is so true. It's amazing to see every technology all around us, and how it truly is improving our lives. And even we are taking it for granted at times. I'd like to bring this to a little bit. I know that was a very huge scale question, to bring it back to Prenuvo. Looking ahead, I know you were just talking about the future of healthcare in that last answer, but looking at Prenuvo, especially with the expansion into new markets, I know including Europe, Australia, what is your long-term vision for the company and its role in helping, as you just mentioned, transforming preventative healthcare in general?
So today we are a company that does what we do, gathers data, delivers insights to patients, and we exist on top of the rest of healthcare. So in addition to it. So in other words, there's a certain amount of preventative medicine that is standard and is recommended by bodies like the USPSTF, which is a task force that the federal government has. And we exist in addition to that. So when we do a Prenuvo scan and we give patients their insights, one of the things we say is, we didn't just replace all that other stuff. You need to do all that other stuff, right? What I will hopefully evolve into with enough data and time is a way to bring as much of that preventative care, right, to a single touch point as possible. And it doesn't mean that we're only ever going to be doing MRI. Like I said, we're adding blood labs to it. But the tricky thing about the current concept of preventative care and the USPSTF recommendations, which are well-meaning, and this is the motherhood and apple pie of medicine. No one would say anything negative about these tests, like colonoscopy, mammography, et cetera. They're absolutely essential. But right, the issue is that they've been developed kind of in an organ system centric model. In other words, you go to one type of doctor for your colonoscopy, you go to another type of doctor for your mammography. There are often then downstream things like, okay, you had this positive thing, now you need another appointment with this other doctor, right? And in order to get all the preventative care you need, you may need to see many doctors and have many stops along the way. So what we're trying to become over time is a place where you can get at least all the diagnostic portions of your preventative care journey in one setting as possible, right? And that's going to involve a lot of change, and transformation here over time. But we think we've done the hardest part of it already, because whole body MRI takes so much data. It's so hard to do. Nobody else does it with the way that we do it or with the level of experience that we do. And these other things that you add to it, like doing blood draws and doing blood labs, the drawing of the blood is something that's pretty straightforward. We were pretty confident we can fold that into our clinic. And there are other things that one might do, like a photograph of the retina or certain parts of the outside of the body, that are pretty easy, relative to the whole body MRI. So we've started with the hardest core capability, and we have these great locations. We have a great brand. We have great relationships with providers and patients. And over time, we want to mature into a company that's just gathering as much diagnostic type information for preventative care as possible. And then potentially delivering some of that virtually, but most likely partnering with others to deliver it.
That's fascinating, Dan. No, and it's clearly a very exciting time for Prenuvo. We'd love to see it. I know we're almost out of time, and at Quantic Conversations, we do always like to kind of wrap things up with, especially when we have an alumnus present with us. I would love to hear, and hopefully you can tell the audience as well, how did your executive MBA from Quantic prepare you for this, entrepreneurial mindset, these aspects for expanding and leading Prenuvo, like I said, in this very successful and exciting time?
Yeah. Well, I'll say that there's this one very unique way, again, because what we're trying to do for Prenuvo, right, is change a really cost-intensive industry by being more efficient and kind of flipping the architectural model. And I'll just say that that Quantic, I could have done my, there's a lot of different ways I could have chosen, like most people, to do an MBA. And I felt like Quantic, just at the gate, was so different because they were willing to rethink the model and deliver it on my terms so much more efficiently. And for adult learners, I think there's nothing more important than that. So like everything I'm about to say, I think it landed better with me because I could build my experience with Quantic around my schedule and all the things that I was trying to do. It was kind of eerie, honestly. Like, so as I progressed through Quantic, I was enrolled in Quantic toward the end of my time at LifeBridge. And then so the first year or so at Prenuvo, I was a Quantic student before finishing up last December. And not so much while I was at LifeBridge, because that was when I was doing the basic, semester coursework, like the basic accounting and all those things up front. And I'd had some of that before, so that was a little more refresher. But particularly the stuff that you don't get in medical school and that you don't get as much of as a consultant, or at least the type of consultant I was, things like organizational design, the kind of like HR type modules, right? And marketing. I think those two in particular were areas that I had very, very little background in, honestly. And they came up, the course material seemed to come up exactly when I needed it to. So I was starting my organizational design right when I landed at Prenuvo and sort of had to start thinking about the first time ever, like really rebuilding or building something from scratch. I mean, I had been at places like Johns Hopkins and McKinsey, and I had been at LifeBridge, and you're inheriting like a whole hospital radiology department. You're not building it from scratch, you're tweaking it, right? And when you do that, in your mind, you're always like, man, I wish I could do this from scratch. And then until you actually have to do it from scratch, and then you're like, my goodness, what do I do? Like, this is going to be such a reflection of my decisions now. I really can't mess it up. So it was like really, really important that I was getting that education and in my Quantic modules. I recommend doing it well before you have these types of jobs. But for me, it was like just in time delivery. So particularly for organizational design and for marketing, because again, like, Prenuvo is a place that I am not that CMO. Like our real CMO is our chief marketing officer, right? But he's someone I work closely with, and understanding, like, so this is the matrix aspect of this. So whereas organizational design was something I was actually going to have to lean in and do, the marketing is something I'm more matrixing in and participating in. But understanding digital marketing, and one of the things, the Quantic curriculum is so much deeper, I think, on the tactical aspects of e-commerce, than anything I've seen elsewhere, honestly. Again, even in more conventional, because I kind of teach part-time at some places, and I've taken coursework at lots of different places, and I've never learned as much about e-commerce, kind of A/B testing, like the really quantitative aspects of digital marketing. And digital marketing for entrepreneurs, like, that's so much more important than other types, because if you're an entrepreneur, that's all you'll be able to afford at first, right? You're not gonna be able to afford like a big Super Bowl ad. You don't have to worry about like production type marketing and things like that. You need to think about how to target the consumer and get your first user base, or test the market and see what type of thing you want to develop. And so that was just incredibly valuable context for me to have. Like, I'm not the person that does that, but to be able to actually hold an intelligent conversation with my chief marketing officer about the marketing aspects as the chief medical officer, I think that was really helpful in building that relationship.
Amazing. It's so great to hear that the curriculum helped in real time too. That's what we love to hear. So that's incredible, Dan. Thank you so much. I know we are at time, but thank you for all of the insights today. It's truly fascinating. Congratulations on all of the success for Prenuvo. We can't wait to follow the company as, again, you continue to be extremely successful. Before we do wrap, though, I'd love for you to be able to tell everyone, where can they follow your work? Where can they stay up to date on all things Prenuvo?
Yeah. So Prenuvo, our biggest presence is likely our Instagram account. We're that type of company. So it's a great way to follow just things about healthcare in general, but also what Prenuvo is doing. I personally use LinkedIn as my main social media outlet. So I will post things occasionally that we're doing at Prenuvo, or scientific studies that we're putting out there. Those are the best ways. And folks can reach out to me through my LinkedIn if they'd want, or through the Quantic network. I think you can message through that as well. So and certainly anyone who's I tend to have a very open door in general, but anyone who's a Quantic alumnus or currently enrolled in Quantic has a special place in my network. And please feel free to reach out to collaborate or just to learn more about what we're doing here.
Amazing. Thank you so much. And yes, I have a feeling you'll be getting a lot of LinkedIn connection requests. I can already see them coming through in the comments. So thank you so much, Dan. That sounds wonderful. And yes, we'll be excited to follow along with all things Prenuvo. And thank you all again for joining us. And we will be sure to see you on the next Quantic Conversation. So stay tuned. Thank you. And thank you, Dan.
Thank you, Kelsey.